Good afternoon. I am Dr. Alinra. So we'll start our lecture ha. Kasi may da ako, we will have to, I will not make it a rush. Something now we will learn, all of us will learn. So welcome to genetics class. Actually, siya, boring na subject, boring na topics, but I hope everyone will enjoy. So I'll be sharing my screen. Okay, so this is genetics. How is everyone pala? Is everyone okay?
Yes, Doc.
Yes.
Nababasa
po,
niyo
Doc.
ako? Okay. And so, the objectives of my lecture is to state essential principles of human genetics and birth defects. Can everyone hear me, ha? Okay lang?
Opo, Doc.
Okay, sige.
Yes po, Doc.
And then, to describe the Mendelian and non-Mendelian patterns of inheritance in humans and list examples of disorder for each type, and to explain the different types of chromosomal abnormalities, and to be able to discuss the different types and mechanisms of mutations in genes leading to disease. So before we come to the lecture proper, we'll first revisit the following terms. I know, carry na natin ini, but then parang for this lecture only, genetics, the science of heredity and biological variation. Genotype is the set of genes of an organism. Meaning set siya. So each one of us composed of set of genes. Di pwede maging mawaray ito sa kaset. Kasi kung mawaray, so we are not here, di ba? Phenotype is a physical manifestation of the genes, and alleles are the different versions of a gene that occupy the same locus. So the phenotype is the physical, the alleles are the versions. So the alleles have two types, homozygous and heterozygous. Homozygous are individuals with identical alleles for a given locus. The heterozygous are the individuals with different alleles for a particular locus. So the dominant, there are two kinds of trait. I know you all know this, the dominant and the recessive. The dominant trait, if a gene in a pair specifies the phenotype instead of the other genes. The recessive traits are traits or diseases that manifest only when both copies of the genes are the same. And then, the locus is the region of the chromosome where a gene is found. Okay na? Okay na kata definition, ha? So let's come to this. This is called a pedigree. I hope every one of you knows this. This is the drawing kung nag-ano kata genetic parang history taking. So we draw this so in the history taking we draw this kind. So this is the recessive inheritance, it's the dominant inheritance. So ano po yung meaning ng recessive? The traits or disease that manifest only when both copies of the genes are the same. So the same siya. It is parang siya is symbolized by the small letter N. Dominant inheritance, parang ano yung meaning nun? is if a gene in a pair specifies the phenotype instead of the other gene, di ba? So affected father, normal mother. So recessive, both may the carrier. So aside from physical history, PE and history taking, we also take our genetic history taking. But there are instances that we only use this. So we do this in order to know if there are disorders that might be irritable, health status of relatives up to the third degree. Kaya nga, hindi tayo pwede mag-fall sa ating mga relative, di ba? Bawal ma-in love up to the third degree. So if you know someone, pakianihiya. Ganito, mag-ano ka rin, mag-pedigree ka rin, di ba? Mag-drawing. So yun. Joking aside. So abnormal reproductive outcomes, past and present drug exposure of the mother and partner, the age of the parents, and the ethnic origin is also essential. Diba? So these are the symbols, common symbols used to construct pedigrees. So hindi na ako mag-aano dyan. So in genetics, kaya nga may genetics tayo na subject because nowadays, common sa atin na there are parents will come to us na, Dok, bakit ganito yung anak ko? Bakit ganito? So when every time hindi sila magkaanak or nagkakaanak sila, palagi may abortion or their children have parang different mga physical features or something different from the normal ones. So we do genetic counseling. Sa genetic counseling, hindi lang yan pa-counsel na ganyan. If we are general pediatricians, general physicians, we usually refer these patients to a team composed of the geneticist, the obstetrician, and the laboratory. So the primary care provider, in which we are the ones, the general practitioners, na refer natin sa obstetrician. So this obstetrician or these pediatricians who are parang trained to do this will refer this to the geneticists. Who are these geneticists? Where can we find them? In the Philippines, we can find them at UP. UP Diliman meron. And then, as far as I know, we are referring our patients sa newborn screening center, which is found in Iloilo. Madami silang geneticists doon. So, kita ng mga general practitioners, general providers, the primary care providers, usually we note for the maternal age, the consanguinity of the parents, early infant losses, may mga abortions ba, gravida 1, para, ganyan. In early infant losses, abnormal TRC, fetal anomalies, and then teratogen exposure of the mother or both parents. So birth defects are abnormalities that affect the body structure or function, including metabolism. The cleft lip or palate is the most common birth defect in the country. So in Mendelian genetics, mutations in genes involving only a single genetic glucose. Single genetic glucose, monogenic, meaning single lang siya na parang ano yung glucose, dyan nakalagay yung ating genes, di ba? So there are 5 lists: the autosomal dominant inheritance, autosomal recessive inheritance, X-linked dominant inheritance, X-linked recessive inheritance, X-linked inheritance. And I don't know about this pala, ganyan. So I'm just going to explain this to you according to my readings. Kasi hindi naman ako geneticist, di ba? Siguro pag may dana geneticist ng RTR, pwede ko na to ibigay, di ba? Na topic. So yun. As of now, si Dr. Ras lang muna. So yun. So in autosomal dominant inheritance, this presence of an abnormal gene in one of the autosomes, di ba? So the characteristics of this is the transmission is vertical, appearing in multiple generations. So parang first degree, second degree, third degree, mayroon. Affected parents have the 50% chance of passing on the abnormal gene to their offspring, and the familiar members who do not have the abnormal gene are unaffected and do not pass the disorder. So kagaya kanina, si father lang affected, si mother hindi affected, si mother hindi nakaka-pass ng genes, diba? The males and the females are equally affected. So ito siya, yung pedigree niya. So one parent affected. So hope naintindihan niyo yung drawing o yung illustration. Examples of this are, the common of these are the familial hypercholesterolemia. In my entire 10 years of practice as a physician, wala pa akong nakita nito. I don't know sa mga high na nga mga centers sa Manila, sa Cebu, I don't know. So one of the most common autosomal disorders in humans, and this is due to a defect in the low-density lipoprotein receptor, your LDR gene on chromosome 19. Di ba? Bigatin siya. Si LDR, si chromosome 19. Let's, parang i-turn on natin yung imagination natin ngayon. So, ngayon siya. Mag-imagine tayo. So, LDL are low-density lipoprotein. This transports our cholesterol from the liver to the tissues of the body. So, kung decrease siya, parang mag-increase, di ba? Si low is the bad cholesterol, di ba? As far as I know, biochem. So the manifestations is increased levels of circulating cholesterol. Kaya nga, kasi bad cholesterol, so nag-i-increase siya. Loss of the feedback inhibition of the HMJ-CoA reductase. Do you still remember HMJ-CoA? Ako 10 years na, kasama ko pa rin siya. I don't know kung may naiba na sa kanya ngayon, di ba? So increased phagocytosis of the low-density lipoprotein by the macrophages. So a person having this will present with elevated serum cholesterol, skin and tendon xanthomas, xanthelasmas, and premature atherosclerosis. So parang naninigas kahit bata pa, 'di ba, sa mga matatanda, injuria, common sa kanilang atherosclerosis kasi nga part of aging. Pero sa mga bata dapat wala. The treatment is statins. This causes the inhibition of your HMJ-CoA reductase. Ano na imagine mo na ngayon si pathway, si HMJ-CoA pathway? Sana na imagine di rin ako mabalik itong adto. Kasi di rin naman ako magbabiochem, di ba? So, are you familiar with this person? Sino siya? Alam niya. Nakilala ka mo yan? Do you know him? Sino siya?
Abraham Lincoln?
Yeah, President of the United States of America. Doctor, what is he doing there? Bakit siya naging part ng genetics? Very much an example of genetics siya. Di ba ang taas niya, ang haba ng mga extremities, di ba? Napapansin niyo ba yung features niya? Yung face, yung mga extremities, yung height, di ba? So what does Abraham Lincoln have? He has Marfan Syndrome. Familiar? Mga dear? Are you familiar with Mr. Marfan Syndrome? Or mag-i-imagine lang naman tayo. Familiar?
Yes, Doc.
Oo, di ba? Ang daming ganito nakikita natin sa movies, mga artista na parang ang haba ng mga extremities, ang haba ng mga ulo, ganyan, mga lieg, ano ba yan? So prevalence of 1 in 5,000 in the general population. This is a connective tissue disease caused by the mutation in fibrillin-1. Si fibrillin na naman, FBN1 gene on the long arm of chromosome 15. Si hypercholesterolemia is chromosome 19. Si Marfan syndrome is chromosome 15. Mga board exam talaga ito, di ba? Fibrillin is a glycoprotein which is essential for the formation of elastic fibers found in your connective tissue. Si fibrillin-1 gene provides the instructions for making fibrillin. So yun, that's the story. So para makadiagnose tayo ng Marfan syndrome, we should use the clinical criteria which is known as the GENT nosology. This includes we will note for the muscular deformities, we will note for the typical stature, unusually long and slender limbs, scoliosis, chest fold deformities, arachnodactyly, ang haba ng mga fingers, hyperextensibility of the joints. And then the cardiovascular aberrations. Some patients will have mitral valve prolapse, mitral regurgitation, aortic root dilatation, aortic competence, which will be diagnosed through your 2D echo. Ocular abnormalities, which includes your myopia, ectopia lentis, and then pulmonary disorders such as spontaneous pneumothorax, apical blebs, Skin abnormalities such as stria atrophica, hernias, lumbosacral ectasias, and then this revised gent and nosology puts more weight on the cardiovascular disorder. As far as I know, when I was in PCMC, ang uso ng Marfan Syndrome doon. Kasi ang daming mga adolescents na ang tataas. So what we do, usually, parang na-memorize na namin si gent. Si Maring Gent na memorize na namin to para ma-diagnose namin si Paring Marfan. Ganyan. So, usually pag kami, nakikita namin agad na may mga long extremities, we usually do our cardio exam, to the echo, ganyan. So pag nag-positive siya, isa lang, usually label the patient as Marfan syndrome. So aortic root aneurysm and ectopia lentis are also identified as cardinal clinical features. So in the absence of a family history and presence of these two manifestations, it is already sufficient for the unequivocal diagnosis of your Marfan syndrome. The treatment is the prevention of the complications. Kaya nga, the complications, the cardiovascular complications, so yun yung tinitreat natin, so we give beta blockers. Affected individuals may have shorter lifespan due to cardiovascular complications, di ba? So, ito siya, the inheritance of the Marfan syndrome. So, si father ang meron, si mother wala. So, half-half. 50% of the children will get the Marfan syndrome. So this is the revised gent criteria. I will not anymore elaborate on that. So meron siya mga katumbas na mga weight of numbers. So maximum total of 20 points. Scores of more than 7 indicate systemic involvement. So ito siya. Ito yung picture. Si pectus carinatum, pectus excavatum. And then you note for this one the rest sign. Commonly we do that. Kasi parang hindi talaga natin maabot yung rest natin. Pero kung ang haba-haba ng mga kamay, maglalalahos pa, di ba? More than pa. Ito siya. Try nyo sa inyong lahat. The thumb sign, in which the thumbnail projects beyond the border of the hand. Ako wala. So wala talaga akong Marfans kasi short ako. Di ba? Dwarfism ang sa akin. Then, ectopia lentis, dislocation of the ocular lens. And then, aortic dissection, di ba? Kilala niyo siya, ang gwapo-gwapo niya, di ba? Sino siya? Or, ako lang mga ka-age group, charot. Kilala niyo siya? Hello?
Yung vampire gan.
Yeah, si vampire daw. Di ba? So, ang gwapo-gwapo niya. So, for that perfect face alone, parang sasabihin natin na walang sakit, di ba? Ito siya, tingnan nyo yung kamay, hyper-elastic. Yun yung kanyang parang ability, special ability daw niya, yung artista na yan. So, aside from the very, very parang perfect na face, he has Ehlers-Danlos syndrome. Ay, ano? Carry si Ehlers. Kilala niyo si Ehlers? Ang kanyang family name, Danlos, ay palitaw, no. Ehlers-Danlos syndrome. This is a group of disorders characterized by defect in the collagen structure synthesis resulting in abnormal production and the secretion of your collagen. This is prevalent in 1 into 5,000 population. So the manifestations of skin and blood vessel fragility, hyperextensibility, transparent skin, hypermobile joints, delayed wound healing. So there are 6 types. The classical type, in which there is skin hyperextensibility, widened atrophic scars, joint hypermobility leading to sprains and dislocations. The hypermobile type, the vascular type, which is thin translucent skin, arthrochalasia type, is severe generalized joint hypermobility and recurrent subluxations and congenital hip dislocation. Ito siguro yung mga sa, ano yan? Circus, di ba? Sa circus, parang ganon. Akala natin gifted children, gifted people, pero may pag pala, mayroon palang sakit. The dermatosparexis type, severe skin fragility and sagging redundant skin. Madami tayong nakikita dyan sa Facebook na ganyan. Kyphoscoliosis type, the generalized joint laxity, severe muscle hypotonia at birth, onset of progressive scoliosis at birth, scleral fragility and rupture of the scleral globe. May patient kami ng residente ako sa EBR-MC pero wala siyang rupture of scleral globe. Minanage siya, ni-refer siya sa geneticist, parang diniagnose siya as Ehlers-Danlos syndrome. Pero hindi namin siya nailaban for pang-case presentation kasi kulang kami ng laboratories. Yun lang. Ang dami natin, tingnan nyo pag nag-clerkship kayo, nag-intern, nag-residente, ang daming patient which will be parang if you can see them, one case, hindi mo na makakalimutan. Sabi mo, thank you Lord, naging doktor ako. Diba? Parang ganun ba? So it's not only that the lesson in this subject is that we should treat our patient holistically. Mag-history tayo, mag-physical exam, hindi lang kung anong pinunta ng patient, ubo lang pinunta, ubo lang iti-treat mo, di ba? So you should interview, you should make history, you should do your physical examination thoroughly. Marami pa kayong makikita sa iyong mga pasyente. So yun. So the treatment is conservative and preventive measures, which includes physical therapy, wearing of protection pads or stockings, and avoiding contact sports. Kawawa naman sila. Pero yung mga nag-acrobatic mga movements, parang okay lang sa kanila, di ba? Hindi sila nasasaktan. Yun yung question ko. Meron ba sa kanila na parang doctor ba sa circus? Yun yung question ko na hindi ko pa nasasagot at wala pa akong natatanungan. Sana may matanungan kayo niyan. Nagpabulig pa, So, this is our scoring. Doon kanina sa Marfan, si Gent yun. Ngayon si Beto naman. So, 111 siya. Hindi siya mahirap i-memorize kasi ang mga mga parang scoring of 1 lang siya. So, ito siya, can you bend your thumb back? Baka ngayon, i-beto score nyo mga sarili nyo, baka meron kayo, balitaw. So, you bend your thumb back, your right thumb again, then your left knee, your right knee, tapos can you put your hands flat on the floor with me straight? Can you bend your little finger up to 90 degrees? Ang sakit niya, di ba? Right hand, left hand, and then can you bend your elbow backwards? Amazing. Right arm, left arm, di ba? So, mga ganyan. So, this is again the pedigree. So, this first na degree, so parang mga mga males affected, tapos may females. Sa second degree, parang ang females na lang, 25%, males 25%, then si female meron na. Sa third degree niya, third degree pala. So fourth degree parang hindi na masyado. More on males na lang, di ba? So neurofibromatosis type 1 or bone wrinkling host disease, this is the defect on the tumor suppressor gene NF1 on chromosome 17. 1 out of 3,500 live births. We also had this one patient when we were on our residency training, a neuro patient brought into us due to seizures. On and off seizures na parang pabalik-balik, EEG na, maintained on phenobarbital, diagnosed with seizure disorder. When Dr. Latorre handled the patient, na PE ni Dr. Latorre, it was during the time na Dr. Latorre was able to see the patient that the patient was diagnosed with neurofibromatosis. Imagine that, di ba? Dahil hindi kami nag-PE ng maayos. Siyempre, residente, di ba? Yun lang, lesson. So, the manifestations are this one, the multiple neurofibromas, cafe-au-lait spots, social siya, cafe-au-lait, dish nodules, optic pathway gliomas, learning disabilities, short stature, seizures, hypertension, malignancies. And our patient, di ko siya makakalimutan even if I was already 10 years nga away from my pediatric residency. Ang patient had cafe-au-lait spots, seizures, and hypertension. Yun yung manifestation ng patient namin. So the treatment is minimal medical management, surgical intervention for tumors, screening for structural and functional complications every 6 months. naka-reach na, during this time, parang alert na kami. So, I have this high index of suspicion in red color. Kasi, why did I did this? Natagan kami in 14 days demerit. Diba? O yun. So, di ko talaga siya makakalimutan. Ganun yan siya. Yung mga cafe au lait spots. Diba? Yan. Ihapit to here. We count that. Ito siya, yung sa eyes. Diba? What do you call that? The optic pathway, the leash nodules, mga ganyan. Ito siya, optic pathway. So for diagnosing this, this is based on the presence of two of the following. 6 or more cafe au lait macules over 5 mm in diameter in prepubertal individuals and 15 mm in greatest diameter in postpubertal individuals. 2 or more neurofibromas, prickling in the axillary or inguinal regions, 2 or more leash nodules, optic glioma, a distinctive osseous lesion such as phenodysplasia or thinning of the long bone cortex or with or without pseudoarthrosis. First degree relative, so we will ask, with any one by the above criteria. Di rin kita mapakya na may daka relative nga may neurofibromatosis, may daka relative na may daka cafe au lait spots, so di ba social naman yan, di ba? So, in our own way, we will ask iton mother kung may da siya nakita ng mga relatives na ganon. So, ato nito way, kung paano natin a-ask. So, this is the end of my first lecture. And let's not take time to deliberate, but when the time for action arrives, stop thinking and go on, di ba? Ano inihiya? In a short way, please, kita at yung mga patient, panginanuahin maupay, di ba? So I'm going to have my video. So, actually, 3 parts in siya. Kasi mahaba, masakit sa lalamunan i-lecture. So, my question, hello? Hi? May question po.
Wala po ata, Doc.
Okay, so Dr. Arminita, can I ask you, maras pa kita ha, kasi ang vocal cords medyo ano na. When is our next meeting? Sa Monday? Do you have a class on Monday? Hello?
Hello, Doc.
Oo, may class ka mo sa Monday?
Meron po, Doc.
So, when will be our next meeting? Or we will...
Monday po, 4 to 6.
Ha?
Monday po, 4 to 6 p.m.
4 to 6. 1 hour na lang, di ba?
2 hours po, Doc.
2 hours, 4 to 6. So, 4 to 6. So, waray ako, pareha sa itong conductor, ayaso nga, medyo conflict ng schedule.
Wala po, Doc.
Okay, sige. So, I will finish the second part and then the third part sa Monday na lang, okay? Okay lang? Sige, I will just share my slides. Sandali lang, ha?